My name's Jay, 67 years old, a retired military, and then I had a second career as a fitness director and outdoor recreation director for a major naval installation. In 1999, I had a bicycle accident that pretty much, broken shoulder, broken wrist, slammed my pelvis, so I had to recover. But prior to that accident, I was running marathons for 30 years, running marathons and ultra marathons and triathlons for cross training. And in '99, I was training for my first Ironman, and I had this bike accident, and so I was basically out of commission for a couple of months, rehabbing, and ever since '99, I've had hip problems. So this chronic injury was interfering with my lifestyle, both professionally and personally. It was affecting my sleep. It was affecting me socially. I wasn't able to hook up with my friends to go out on training runs. I would see the doctor and they would try the NSAIDs. They would try physical therapy. And what they were doing is just getting me back to being functional, but I really couldn't return to the activity levels that I wanted. I went to a pain management doctor and he evaluated the situation, and he did all the injections to the hip and the lumbar region. When I wasn't getting any relief from the injections, we went to spinal ablation. And so after 3 treatments of spinal ablation, I was not getting the relief I was looking for and needed. And that's when, talking to my rheumatologist, we had a discussion regarding SI fusion. So I researched, Googled SI joint and found SI bone website. So the website, explained the procedure to me, what was all involved, how minimally invasive it was. And they actually looked at my zip code and made a recommendation for a doctor, a surgeon, who did it locally, SI joint fusion. And that's when I went and found Dr. Vanini. And so after an assessment with them, they looked at the function of my SI joint, and having seen all the other procedures that I had gone through, we recommended some therapy for hip stabilization, because I've been inactive with this SI joint. So the hip stabilization physical therapy for a month really helped me stabilize and prepared me for the surgery. I was in the best condition I could be in going in. Had the procedure done. It was outpatient. I was home that afternoon, and it was so good that I actually started to do some walking in the cul-de-sac, and I had trouble getting to the mailbox. And here I was that afternoon making rounds. Of course, there were short distances, so I just upped the frequency to 6-7 times a day, and as the distances increased, I reduced the frequency, and as I recover, increased my activities, the kayaking and the hiking and the fishing and the disc golf, all of these activities. And my family's even found me to be a lot more fun to be around, because I'm sleeping better, I'm not so irritable, I'm social again, I'm visiting my friends, and I have my life back now. I don't have any regrets on this procedure whatsoever. I just wish I had done it sooner, but you have to try all the most conservative measures first. So it is a step, and if you continue to have the pain, don't hesitate to educate yourself. Information is painless, so the more qualified information you get, visit the doctors, talk to them, they'll educate you and they'll evaluate you. Don't wait, don't put it off. There's no reason to suffer. And I now am able to go back to all the activity levels that I want to do. I have my life back now.